Awesome. All right. So for those who are joining us later on YouTube or watching later with us, we've got Christy and Paloma here with Maxim, and they're going to share a little bit about what that looks like to develop a caregiving plan with ALS. So yeah, take it away.
Great. Good afternoon, everybody. My name is Christy. I'm with Maxim Healthcare Services, and I help with the in-home nursing division. Today we are here to present about how to develop a caregiving plan. So I am going to share my screen and go through a short PowerPoint presentation. We'd love for this to be super interactive. So if anybody has questions about anything, please don't hesitate to ask. We do not have to wait to the very end. Would love to hear any feedback as well during the presentation. So I'm going to share this and let me know if it looks correct on your end. Okay. Can you see the presentation?
Yep, looks good.
Okay, great. So we're Maxim Healthcare Services. We provide in-home services for clients that are needing some additional assistance in the home. And so our two divisions are, we actually have multiple divisions, but the two that are most pertinent to clients that may have ALS would be unskilled care, which is CNA, HHA, home health aid level, personal care assistance, and companion care. And then my division, which is skilled nursing, RN or LVN level care, and we also can do in-home therapies. We're really here to support families through any stages of ALS. We understand that no two clients are the same, and so we're really here to be a resource. And we hope that the biggest takeaway that you get from this presentation is that we're here to be a resource for you, to help you navigate through insurances and kind of helping create a plan of care so that if as the disease progresses, and if it does, we can be proactive about planning for the next steps. We do have two divisions so that everything is pretty fluid, and you could start with one and go to the other, or vice versa. It's just a very fluid type of service. And so, Paloma, would you like to start with yours?
Absolutely. Next slide, Christy. Okay, while she's getting the slide ready for us, I'll go ahead and introduce myself. My name is Paloma Martinez, and I'm the Business Development Manager here at Maxim Healthcare, and I help support for all unskilled services for clients out there in our community. We pretty much cover the whole county of San Diego. And with that being said, I'm going to move forward with how my office supports our patients, our pals. Christy?
Am I on the right slide? Or you want the next one?
Let's move to types of services.
Is that right?
Do you guys see it? Does anyone else see it?
I don't think the slide is moving. It's the,
Yeah.
like, looks like the title slide.
Must be frozen. Any movement?
No.
Okay. Let me stop sharing and I will re-share.
Take two.
Is it moving?
Yes.
Oh, great.
All right. So I'm going to be talking a little bit about what unskilled services look like for our pals in our community and how we can support. Under unskilled, we can support with personal care assistance, respite care to the family member, the loved one that's caring for the person diagnosed with this disease. Also companion care and transportation assistance when needed. So going a little bit into detail into what's personal care assistance. Basically what that is it's more hands-on. So you will have a qualified caregiver that has experience providing that personal care aspect. That can be, bathing, dressing, assistance with toileting, and that sort of assistance. When it comes to respite care, so the word respite is more of giving a family member a break. Let's say, for example, I believe we have a house member here that has mom. Say mom is helping out with pretty much everything. Mom's feeling overwhelmed and just needs a break. We can send a provider out there that's gonna give the family member a break. When it comes to companion care, it's just pretty much, self-explanatory, just being a companion there for the loved one, providing companionship, no personal care. And we also provide transportation assistance, so we can accompany to any medical appointments. We can go ahead and run errands. Pretty much, while we have a family member there caring for the loved one, we can take care of all the grocery shopping, picking up medication, that sort of thing. Next slide, Christy. Okay. So in order to get started with Maxim, or not, like Christy said, we don't have to, you don't have to be a Maxim client to reach out to us. We're always going to be that resource, and we can always connect you to the right service that you're looking for. So for that, we can do a phone consultation, or we can also do an in-home consultation. This is a free consultation where we come out to the home. We have the opportunity to meet our client, which I love. I love meeting my clients. It gives me an idea of who I'm going to be staffing with the clients and what the needs are when I am staffing. Or say, for example, if it's not the right service and it's a skilled nursing service, I can always talk to my colleague Christy, and we can partner up to see what's going to be more successful when creating a plan of care. And these services can be followed in the home, rehab, hospital, wherever our client is. That's where we provide the support. Next slide.
I just wanted to add to there, even if you're in a place where you're just trying to figure out where you're at or what you would want the next step to be, we've referred so many people just for that consultation. Even if you're like, I don't know who I'd want to provide services with and who to connect there, we've heard great feedback there. So we're really appreciative even of that consultation. Our families have said awesome things.
Absolutely. And it just gives the family, that peace of mind, having someone come in the home and hearing other options, providing comfort and, being that resource. So, even if it's just a consultation, feel free to reach out to us. During these consultations, all findings and requests are then incorporated into the plan of care that you see in the screen. And basically, we go over this plan of care, with the whole family, with our client. This is the plan of care that we go over with our caregivers. So we try to add as much as we can to this plan of care. What are toileting needs, nutrition, is our client on a special smoothie diet? We also talk about, any personal assistance, bathing, general client information. So, we tailor this plan of care based on the client's needs. And this is a plan of care that can always change. So we can always add, we can always take away from the plan of care. So basically, it's just there to make sure that we are doing X, Y, and Z based on the family's request. Next slide, please. I wanted to list this out there so that everyone can see and have this visual on what we can do. I know I talked about it a little bit, but the personal assistance, again, the bathing, the grooming, changing the pants, medication reminders, assistance with mobility, range of motion, the transfer assistance. We have caregivers that are experienced working with ALS patients, so they know how to utilize a Hoyer lift. They know about the communication devices that we now see out there, which I feel like they're amazing ways to communicate. The companionship, the light housekeeping, the running errands, escorting to appointments. And then we also like to get to know our clients. So what are your hobbies? What are some things that you like to do that are going to get you, the situation, it's, as the disease progresses, we still want to make sure that our client is doing or listening to their favorite music and doing some of the things they enjoy doing. So again, that relationship piece is something very important to me when I am staffing a caregiver with my client. Next slide, please. Some of the benefits, if you do choose, to go with Maxim, is that we are available 24/7 for our clients. Even if you don't sign an agreement of services with us, we're always here to be a resource. We do have a team of recruiters that are constantly hiring based on the needs in our community. So the prompt response, you will always have that. We have a free consultation, and for our pals, we do offer a discounted rate when it comes to the option of paying out of pocket. Another way to pay for our services would be having, if you have a long-term care insurance policy, we can always work with that. And we can always get creative on how we can support. Next slide, please.
Okay, so for my division in home nursing care, it's also known as private duty nursing. We provide continuous one-on-one skilled nursing care at the home. We have RNs and LVNs that will be out in the home. It's really long-term care, so 40 hours a week up to 24/7 care. Are the services that we provide, we help with mechanical ventilation, any tracheostomy management, oxygen administration, any kind of G-tube feeds or IV management, and then medication management, and we also do in-home therapies. The setting in the home for nursing can be, helping with activities of daily living, but you have a nurse that can be there in the event of emergencies, but it can also help with doing the tasks that need to be completed on a daily basis, and it could look like almost ICU level of care. So it's a really, really broad spectrum. The nurse's scope of practice, it's total care, like I said before, activities of daily living. They can go to doctor's appointments or therapy appointments with the client, and every shift is documented, and so any trends or anything like that can be tracked. Our nurses all follow doctor's orders, and so there is a plan of care that we generate, and the nurses will document throughout their shift and follow whatever the doctor has ordered for. They can help with equipment management, help order supplies, help keep the area that the client is in clean, anything to do with the client's care and daily care. There are a few ways to qualify for private duty nursing. The doctor will have to approve for services because everything we do is through doctor's orders. So a lot of times there needs to be some sort of a skilled need, such as in order to get one-on-one nursing care, such as having oxygen or needing medication management, something that a caregiver wouldn't be able to do. And then oftentimes we work with insurance, and we also need insurance approval if insurance will be funding this, and also a suitable in-home environment. A little bit about insurance coverage. I know it's very complicated at times, unfortunately. Private duty nursing is primarily covered by a primary insurance or a secondary insurance. Private pay is also an option, but a lot of times we help the families most by navigating through their insurance. We can also help with appealing private insurance if that's not something that's already approved, or helping families with applying onto a waiver so that they can qualify for Medi-Cal. Specifically, the waiver here in San Diego is called the HCBA waiver, and it's run through San Ysidro Health. And so they help look at the client on a medical basis instead of financially, in order to qualify them for Medi-Cal. Some insurances that we are contracted with that do provide in-home nursing services would be insurance through the VA, Medi-Cal, workers' comp, and different types of private insurances. Part of just proactively planning for the future, we are happy to look at any insurance benefits and just see what may be qualified and what may not be covered. Ultimately, like I said before, like, let us be your biggest resource. We could help with future care planning. Paloma does in-home assessments. We do that as well. We can have a nurse come out to the home. We can help with insurance and benefit verification, help with any type of enrollment into local programs, help with appeals or anything like that. So we do have two divisions. So like I had said before, it's pretty fluid in transferring services and kind of figuring out what's best for the patient. Are there any questions for us?
I have a question.
Yes.
Well, first, I was wondering if you guys could put your contact information in
Sure.
the chat, like a phone number, email, and then maybe also for the recording, if you could verbalize that, just for those who are watching later, just the best way to get a hold of you for questions or possibly a home consultation. And then one question I had, I know that your long-term care can go up to 40 hours a week, like 20, but is there a minimum of hours per week that that would be required?
We typically try to do at least somewhat full-time hours, just because it is quite challenging to find a nurse that will just do 4 hours a week, and not have more hours. So every case is different. So we're happy to see what fits best with the family, but typically they begin with like 24 to 36 hours a week, which comes out to 3 or 4 8-hour shifts, and then can go up from there.
Right, and then for skilled services, we don't have an hourly minimum. So we can go as low as 4 hours a day up to 24/7. And if you're unsure of what service you qualify for, Christy and I will be more than happy to come out to your home to do one of these evaluations, assessments, to see what service, it's more suitable for you.
Mm-hmm. And I see a question here, whether or not we accept Medicare. So unfortunately, Medicare does not have any type of benefits for private duty nursing. However, if you are interested in starting the process to apply for Medi-Cal, you can have both. They do authorize for private duty nursing. There are some things you have to do financially, but happy to be a resource for that if you have additional questions.
Hi, this is Romy. I have a question.
Yes.
So I'm on a schedule where I need someone for about 2.5 hours in the morning and 2.5 hours at night. And it really is between caregiver and CNA. Some caregivers will not do like catheter care. They won't change bags. But those are my basic needs. It's really light duty, but we're having a heck of a time keeping CNAs here. And I am private pay. I do pay CNAs. Everybody's a 2-hour minimum at least, even if you're only here an hour. And we cannot keep people. They love it here, but other jobs pull them away. So do you have anything within your company that would allow me to get the CNAs I need?
Yeah, so the 2-hour visits, basically called visits, it could be anything from 2 hours or less. And when it comes to the catheter, we can only empty the catheter bag. Our home care license, because we are a non-skilled office with my division, we're not allowed to do anything else than emptying the catheter bag.
Okay, are you allowed to change the catheter bag?
Yes, so unfortunately, that is something that we will not be able to do. We can only empty the bag.
Okay, so that kind of answers my question.
Yeah.
Yeah, I can empty my bag if I'm up. I can't
Right.
change the bag. You just take two edges and push them together. It doesn't take skills.
Right.
Yeah, it's just with us, we have to follow state guidelines because we are accredited with the state. And so if you do private pay, they can do anything that you request them for when it's not through an agency like ours. But because of our regulations, we have to follow what the state dictates.
And the state says you can't change a bag unless you're an LVN. I'm not talking about changing the catheter tube, just the bag that attaches it, from the day bag to a night bag.
Yeah, I think, Paloma, if you have additional, in my understanding, an LVN is the only one that can touch any kind of equipment, administer medications or anything like that.
Right, that does come up a lot. And unfortunately, we do have to, we want to keep our license. So we have to make sure that we are following what we can and cannot do. When it comes to the catheter, we can only empty the catheter bag. And that's the same thing with any feeding tubes. And also we cannot manage a BiPAP machine as well. I know that has come up in the past.
You can't turn a button on a BiPAP machine.
Right.
Okay.
Mm-hmm.
So that kind of limits your utility to an ALS patient.
Right, that's something that our skilled nursing department, maybe Christy, that's something that, when we come out to do an evaluation, when we hear those needs, that's when we partner up to see what service is going to match you the best.
Okay.
Mm-hmm.
So that answers my question. Thank you very much.
Great question.
Welcome.
Thank you for asking.
Yes.
Any other questions for us? I also want to add that when we go do these assessments, I know that it can be a little bit, for example, I'm a very private person, so having someone new in my home can be, a little different. So we do offer meet and greets. So if you're looking to, start services with us for unskilled services, we can always set up a meet and greet so that you can get to know the caregiver. The caregiver comes out to the home as well, gets to know the environment. That way the relationship is there before we begin the services.
Yeah, thanks, Paloma. I guess one of my questions, and this is really, I guess, on behalf of some questions I've had before too, is a lot of times, especially if someone is saying, okay, well, a family member of mine or someone that lives with me is really helping with some of those caregiving needs. When do I kind of take that step of bringing someone else in? Like, where's kind of that maybe, step or line of when I kind of go outside of that family member or that, support. So I don't know if you have any insight or thoughts there.
I would say is just identifying as a family, having that dialogue until when, like sometimes, we like to take care of everything. We all need the help, we all need that break. So, having that alone time with yourself and just acknowledging like, look, I need help with my husband or with my wife. I need this break. It's just having that internal conversation with you, because it can be very overwhelming having a lot of that responsibility. And I'm sure your loved one will want to see you, have a full 8 hours of sleep and have that break. So I think that's a conversation that you will need to have with yourself or with your loved ones, and also accept that there is people out there to help you and support. And that's when we come in, Melissa, Keith, and just speaking up And, again, we can always start off just with a consultation, baby steps. It's okay to be, to be afraid of that big step. But eventually, you will need the support of the team.
And I would say for nursing care, it really is dependent on working with your medical team and what the doctor is recommending as well. But oftentimes it's just somebody there as a second set of hands to help with anything, or a peace of mind. For example, we service a patient that gets 24/7 care, and he has caregivers during the day, but at nighttime, he has a nurse that's there from 11 p.m. to 7 a.m. And so this just allows the family to sleep and know that the nurse will be administrating any type of medications during a certain amount of time, or are there just to provide that extra set of care that perhaps like not a caregiver would not be able to do. So it just really is dependent on what the medical team and what the family would prefer.
Thank you. Well, anyone else that's with us? Anyone have any thoughts or questions on your mind? Anything coming up?
Okay. Okay, well, we're always available here, as Christy and I mentioned. We're here resource. If you have a question, anything comes to mind, feel free to give us a call. Again, we're Maxim Healthcare, and I am Paloma, and you can reach me at 619-298-7548. I'm going to give that number again. That is 619-298-7548, and this is for unskilled services. Christy is literally next door to me. So we're in the same building. So whenever I go meet someone, I talk to her and we brainstorm on, how we're going to move forward with this patient. So, if you can get in touch with me, you talk to Christy, just know that we work together.
Yep, and I typed my information, my phone number and email in the chat, so feel free to reach out. And we are excited for the upcoming events. I know the walk is coming up, and so very excited to participate in that again this year.
October 17th, Walk to Defeat ALS.
Yay.
We always love to support our ALS chapter.
Thank you.
All right, guys. Well, if no other questions are popping up, then we can kind of close here. But yeah, Christy, Paloma, thank you so much just for sharing and being a resource. And you've been a resource for a long time with us. So we just really appreciate you both.
Yes, thank you. Looking forward to seeing all you guys again soon. Thank you for joining us.
Awesome. Good to see everyone.
Bye.
Bye, guys. Thank you.
Bye-bye.